Day 1175 of this Trump administration, 209 days to go until the presidential election. Another record day across this country in all the bad ways. At today's White House briefing, in what may be a continuation of a rather perverse lesson in adjusting expectations, the president wanting always to show he acted early and decisively against the virus and was never a denier, said today if the death toll in this country is substantially under 100,000 people, as he put it, we did a very good job. He said today he considers the country ahead of schedule. He says he wants to reopen the country with a big bang. And right before leaving the stage, he said, we're really in great shape. He left the briefing room. Mike Pence started to talk about the grim week we are witnessing here in these United States. The number of confirmed cases worldwide now at 1.5 million. In this country, nearly 15,000 people have lost their lives thus far. At the epicenter of this crisis, New York again reporting its highest single-day death toll with 779 souls lost in 24 hours. New Jersey also hit its own one-day record, 275 deaths. New York has more confirmed cases than any other country in the world, except for the United States. Yet again today, Governor Cuomo of New York said the latest data indicates the curve of infection is flattening.
The number of patients hospitalized is down. And again, we don't look at just day-to-day data. You look at the 3-day trend. There's no doubt that we can't stop doing what we're doing.
Politico reporting Vice President Pence and Dr. Tony Fauci told lawmakers they, too, were seeing signs of stabilization and that the administration is now actively exploring ways to return the shutdown nation back to normal. At this afternoon's White House briefing, Trump focused on those glimmers of progress.
We're hopefully heading toward a final stretch, the light at the end of the tunnel, as I was saying. As we continue to wage all-out medical war to defeat the virus, we're also fighting an economic war to ensure we can quickly turn to full financial strength.
What specifically has to happen for you to feel that it's safe to reopen the country, and what is your plan to do that?
Well, I think we can say that we have to be on that downside of that slope and heading to a very strong direction that this thing is gone. Now, we could do it in phases. We can go to some areas, which some areas are much less affected than others. But it would be nice to be able to open with a big bang.
Wouldn't do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them, yeah.
Do you think, is there a system for monitoring and testing that you're looking at?
Yeah, we're putting in very heavy testing systems.
He's talked about that notion before of opening regionally. It's still not clear how any of that would take place, especially given the current level of testing in this country. We've only tested 0.6% of the population. Yet the director of the CDC came to the briefing with new guidelines outlining how essential employees can return to their jobs even if they've been exposed.
These are individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work. If they're asymptomatic, they could go back to work if they do several things, as we say here. Take their temperature before they go to work, wear a face mask at all times, and practice social distancing when they're at work.
Stands to reason if people go out too early, the curve creates a bounce. The president is still talking about his goal of Easter Sunday to pack the churches in this country, you'll recall, and get back to work. Well, of course, Easter Sunday is 4 days away. He concedes that isn't going to happen, but he wants credit for the idea while wanting to claim he wasn't entirely serious.
I had a date, and I thought it was a very aspirational date. It's turning out to be very interesting because a lot of good things are happening by Easter. But I had a very aspirational date. I didn't think we could make it. I didn't say we would do it by Easter, but I said, boy, wouldn't that be great to shoot for Easter? That would be a great day, beautiful day, very important day to a lot of people like me and like some of you in the room. maybe all of you in the room, frankly. But Easter is a very important day. So I had, aspirationally, I said, let's see if we can do it at Easter. But I said it would be very tough. And I was criticized for that. So I don't like giving dates. And that wasn't a date. That was just an aspiration. That would have been incredible. But I don't think we're going to be very far behind. And some of these models are looking like Easter is going to be a very important date anyway because of the curve. I mean, it's hitting the top and it's starting to come down. And one person said Easter is looking like a good time. So a good time for that, for heading down.
In the real world, on this Passover night, the number of virus cases is now growing quickly in cities like Philadelphia, Baltimore, Washington, D.C. There's more reporting today on the rapid spread of the illness in less populated parts of our country. President Trump also promoting the use of that anti-malaria drug against the coronavirus, even though many doctors and public health experts are not yet endorsing an unproven treatment.
Our national stockpile is now equipped with nearly 30 million hydroxychloroquine pills. So we're up to about 30 million. We're distributing by the millions. In addition, the azithromycin and zinc. They say zinc. You should add zinc. Now, it's all has to be recommended by doctors, physicians. But they say zinc. I want to throw that out there because that's where they seem to be having the best result. So you add the zinc and the azithromycin, and it's been we've had a lot of good stories.
We'll talk about this with our guests in a bit. The vice president did say there are at least 4 separate clinical trials underway studying this hydroxychloroquine. There's also news concerning the White House original projection of as many as 200,000 virus fatalities, even with social distancing in effect. Those numbers are now being reversed and revised downward. One model used by the administration's task force puts the number at 60,000 and 400 COVID-related U.S. deaths by August. Today, Dr. Deborah Birx said it's evidence social distancing may be working.
That is modeled on what America is doing. That's what's happening. Americans are in adapting to and following through on these behavioral changes, and that's what's changing the rate of new cases, and that's what will change the mortality going forward.
The president was asked again today about that January memo from his trade advisor, Peter Navarro, who warned about the risks and potential costs of a pandemic. A memo the president said yesterday he hadn't read as of yesterday. Here's what he had to say today.
Were you ever briefed on those memos? Did you ever discuss those memos with anybody?
I don't remember that. I've now seen the memo. I saw it. It was Peter sends a lot of memos. I didn't see the memo. As you know, World Health was saying that was not correct because at the time they called it wrong. But I didn't see the memo. But I acted as quickly as people were shocked that I acted so quickly.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.